Good evening and welcome. My name's Rudy Page. It's great to be back again here on Africans in London TV. And today we're going to be focusing on community pharmacy and the role of community pharmacy as it relates to the vaccine confidence. And our two guests this evening will be Bola and Afisi. Good evening, Bola.
Hello.
Good evening.
Hi.
Good evening.
I hope all is well.
Yes.
Excellent, excellent. So welcome to Vaccine Confidence Dialogues. And of course, we're online. And I'm so pleased that you're here as community pharmacists based in London. So to kick off the program, Bola, tell us about yourself and how you became a pharmacist. Many people don't realize that you are in fact a scientist.
Yes, I am a scientist. Thank you for inviting me to this program. And I'll do my very best to, answer your questions and give you as much information as you need. So I became a pharmacist, about 35 years ago. So my main decision to become a pharmacist was really exploring what I wanted to do. So I was good at sciences, and I knew I wanted to go into the healthcare profession. So I was toying between being a doctor and a pharmacist. Fortunately, I had a very good chemistry and physics teacher who also doubled up as a careers advisor, and helped me understand the two roles. And believe it or not, the swinging point was actually pharmacy degree is a shorter degree, and also I wouldn't have to do call outs at night. I wanted to be able to sleep at night. But on a serious note, it just sounded interesting, and it, just aligned with my interests. So I could have easily gone either way, but that's how I made my decision to become a pharmacist. So I started off my pharmacy career in Nigeria. So I went to university in Nigeria, and also here, you would need your A levels, your GCSEs, good GCSEs in sciences. A levels, you need AABs, mainly physics, chemistry, biology, or physics, chemistry, maths, and maybe science subject. Then currently in the UK, it's a 4-year degree, and it's a master's degree. And after graduating from university, you would spend a year learning the profession. So that's what we call the pre-registration year, and pharmacists are referred to as pre-registration pharmacists. So they'd work for a whole year, getting real experience, being supervised by a more senior pharmacist with at least 3 years experience. And at the end of that year, they sit an exam and pass, and then become a pharmacist. So in total, for someone to actually register and practice as a pharmacist, you're looking at 5 years. Now, as I said earlier on, a pharmacist has a master's degree and also a 1-year work experience before they're fully registered. Yes, and pharmacists also then can go on and develop further to have other postgraduate qualifications. So as an example, I've got a postgraduate diploma in clinical pharmacy, with my areas of interest are around the elderly, travel health, and respiratory and musculoskeletal, which is aches and pains. And I can also prescribe. So that's me in a nutshell.
Afisi, tell us about your journey, your pharmacy to become a pharmacist.
Yeah, hello everybody. Coincidentally, just like Bola said, I've told kind of the same way. I did my pharmacy degree in Nigeria. And like she said, for you to be a pharmacist, become a pharmacist in Nigeria, you have to have very strong pharmacy background. So I was very strong in physics, chemistry, biology, and maths. And we have very similar stories, but I grew up in a university environment. My parents were both lecturers. So I had the opportunity to see pharmacists, both as lecturers and in hospitals. So I think there was a time I was in between choosing medicine or pharmacy, but there was a lady I really admired on campus. And I could see what she did. And I could see that she was flexible. She was a lecturer as well as a practicing pharmacist. So that made me lean towards that way. And in Nigeria, you have to do 5 years, like Bola said, and you have to do a pre-registration year. So I did mine in hospital. So that's where I gathered I started off my hospital background. And when I came to the UK, I still had to go back to school. So acquiring more knowledge. Went to Sunderland, did a year there, and did another year of internship here, but then in community pharmacy. And that was where my interest in community pharmacy really, really started. I loved dealing with people. I loved the interaction, seeing people today, they come to you with an illness or one concern or the other, and the next day coming back to you with a feedback. The day-to-day dealings with them, seeing people, watching them from when the children were in the tummy, really, and then seeing them as toddlers, and these days seeing them as young teenagers and even adults. It's really rewarding.
Right. So you started to describe your role as a community pharmacist. So what else does this area of work cover?
Oh, lots. Our day-to-day workload could start with, it could be anything. I say it to my team. 1 minute, we're dealing with our day-to-day service, which is dispensing, looking at prescriptions. And it's not just looking at prescriptions. You're analyzing, you're seeing if it's safe, whether it's suited to the patient, whether how good clinically it is for the patient, side effects, so many things you're dealing with. And then you could be in the middle of that, and we're very good multitaskers. So you could be dealing with a prescription and the phone rings, and it's you dealing with a hospital, talking about someone's prescription, someone who is about to be discharged. You know the person best, which is why the hospital call you. You analyze the person's history with the doctor or with the pharmacist on the other end of the phone. You give, you talk to the other healthcare professionals, give advice. They give you tell you what they think about the patient. We work hand in hand with them just to make sure that the person is not re-admitted into hospital. So 1 minute you're on the phone, the next you're on the counter, dealing with patients. They're coming in through the door, leaving with safe and adequate advice. So excellent. We are giving advice on OTCs. You're dealing with doctors. You're dealing with prescriptions, phone calls, everything. Yeah. So that's what we do.
Yeah. Thanks for that. And Bola, yourself, obviously similar, but
similar. Your activity. That's right. So in general, pharmacists provide all those services that Afisi has described. In addition to that, there are other services, for example, that we provide on behalf of public health and the local public health within the local authority around health checks. As you would know, there's a high degree of cardiovascular events within our local populations. So they've commissioned a number of pharmacies to provide those health checks, on which basically they would do a number of tests, measure your cholesterol, check your blood pressure, your height, your weight, put all those together, and they would analyze and give you the results of your test, which would be the risk of having either a heart attack or a stroke over the next 10 years. So, and they'll be able to discuss what you need to do to actually maintain an acceptable risk. So in other ways, what we're saying is that we provide healthy lifestyle advice. Yeah. Most of the pharmacists, I mean, apart from the pharmacists being highly qualified, we train our staff. All our staff have to have a minimum level of training. And so that's why when you go into pharmacy, you know, the staff would ask you, have you had this before? Who is it for? What are your symptoms? We need to know all these. We will provide that information and advise. But also, one of the things that we also do is ensure that the medicines that people are taking are right for that person. Mm-hmm. People are at the right time. People have an understanding of why they're taking the medicines. Mm-hmm. That's very important. Another very important service that we provide is the vaccination service. Mm-hmm. So flu vaccine, you know, if you've been invited for your flu vaccine, you don't need an appointment, you pop into the pharmacy and you get your flu vaccine. It's very important. So there's a whole lot of things that we do.
Thank you. Thank you for that. So as you mentioned the word vaccine, have you been involved in the vaccine rollout?
Okay. So pharmacists in general have been involved in the role of the vaccine rollout. You know, you have hospital pharmacists, you have pharmacists in GP practices, and then you have community pharmacists. So I'm going to speak in terms of community pharmacists. So community pharmacists in Croydon, for example, where we're based, there are a couple of community pharmacists who actually are involved in administering the vaccine. But right across London, there are various pharmacies who are administering the vaccine. Pharmacies are very accessible, and there is, you know, once people book the appointments, they can easily go to the pharmacist. But also, what every pharmacist has been involved in is providing information, factual information and advice to members of the public, and also reassuring members of the public. Personally, what we've done in my pharmacy is that we've educated the staff, we've encouraged the staff, advised them. So the staff themselves, all of us have had the vaccine, and I'm very proud to say that, you know, we've all been able to have the vaccine and we're all well. I had it first, and I was able to actually offer confidence in the process to members of staff. So that's the main way.
Thanks for that. Yeah. Ifeisi, have you been involved, and what has been your role in the vaccine rollout?
Right. So I'm in Croydon, like Bola, and we're new at Inton actually, and we've got a diverse, range of people in our community. We've got Asians, we've got Black, Afro-Caribbeans, we've got white people, we've got everybody. And so when, as you know, in the very acute phase of COVID, there was a lot of anxiety and all that. So we had to play a major part in allaying the fears of people and all that. The fears when the COVID started. So not only did we have to allay their fears, we had to keep ourselves up to date and give them evidence-based information. So we had to go, the Department of Health was sending us out daily bulletins, which we had to read, digest and educate, like Bola said, educate us, our members of staff. We made sure everybody knew what was happening at any stage. And as you realize that it was fast changing. So we had to keep ourselves up, educate ourselves, and educate the public as well, who were very, very anxious. And a lot of people's mental health was affected, including us as well. But we had to play that part. Our doors were open. We had to reassure the public. When the vaccine started, we've had people coming through the doors. We have a lot of people who rely on us for safe and truthful, should I say, information. So people, as we all know, a lot of things were going on social media. People were getting loads of misinformation. Many people came to pharmacies because we had our doors open. They were coming to us with all sorts, showing us the text messages. Many of us pharmacists had to lead the way. I took my vaccine as soon as I could. Because when people come to you and you're telling them to take the vaccine, or not even advising them to take the vaccine, and the next question is, have you taken it?
Exactly.
Will you ask your mom to take it?
Yeah.
And say, yes, I straight away, I tell you I've taken it. And because we know a lot of them and on very cordial terms with them, I show you a picture of me. I got a picture. So that did a lot. It did a lot.
So it's a trust. And that's the key thing in terms of community pharmacies. You're known to be trustworthy, there's confidence, you can be accessed locally, and you empower the patients and the people who visit you, which is great. So are there any costs now to seeking advice, or can the public, can they just walk in and speak to you? How does it normally work? But if people are unsure, can they just turn up and just get the information and the reassurance that they're looking for? What's the normal process?
Community pharmacies are readily accessible. It's documented fact that every person or most people are within 10 minutes, either driving of a community pharmacy. There are no appointments generally for seeking advice with a pharmacist. So you can walk in and ask to speak to a pharmacist, and that pharmacist will provide the advice. It is free. Now, there are certain services which may not be free, but in general, if you're seeking advice for your prescribed medicines, that's prescribed by a doctor, they'll be free. If you're seeking advice for over-the-counter medicines, that's medicines that you can buy off the shelf in the pharmacy, that is free as well. Our staff, as I said earlier on, are very highly trained. They know their products. They will be able to advise on the products. If they don't know, then they can ask the pharmacist. Again, the pharmacist, unbelievably, as Facey said earlier on, we multitask. So if staff are talking to you on the shop floor, believe me, the pharmacist is hearing most of it. So the pharmacist will intervene if necessary, and likewise, the staff know when to escalate to the pharmacist. Now, all pharmacists have a consulting room, so if it needs to be private and confidential, then you can ask to use the consulting room.
Okay, thanks for that. Efisi, is there anything you want to add to any other points you want to add to that?
No, I think when it comes to advice, Bola has pretty much said everything. It's just that a reminder that there's open and direct access to pharmacists who are professionals, who even these days we have regular people coming in. We have access to their history. So there's some information you would need. We can easily check. So when you come in, for example, and you want to buy some medicine and the counter assistant speaks to the pharmacist, we're able to check with your medicines to see if there are any interactions, and straight away can give you a reply straight away.
Right.
So this is at no cost.
Okay. Good. That's really important that the public understand they can just walk in, get the information, get the advice, and really the reassurance that they're seeking, it will be provided to them in a friendly way. So another area of concern is around the government and the NHS policies for people who may be refugees or undocumented. So can they still get the vaccine? And a great concern to some people is, will their information be shared with any other government agency or entity?
So I'm happy to answer that if that's okay. Okay. So everybody has free access to the vaccine, irrespective of their immigration status. And this is clearly documented or publicized on the government website. Different areas have made different facilities available. So in some areas, they've gone to specific hostels where they vaccinated homeless people. Go to a vaccination center. Obviously, they're all by appointment, so they haven't been invited because they're not documented. There's a helpline, which is 119, and they can access that.
So 119?
119, yes.
Okay.
Again, the information would not be shared. There is confidentiality within healthcare services, and information cannot be shared without the person's consent. So people should be assured that their details will not be shared and that the vaccination is free. And both homeless people and migrants have access and should be given the vaccine.
Okay, thanks for that. That's very clear. So as a refugee, as an undocumented person, then there are no barriers to receiving the vaccine.
There are no barriers to receiving the vaccine, as well as healthcare services.
Yeah, absolutely. Great. So I want to go back to, for both of you, just to talk about some of the stories from people, clients around the vaccine, and how you persuaded them, and some of the things that they brought to you, and how you've been able to reassure them, and I know there's some funny aspects to it as well. So it'd be interesting to hear some of those stories. So Afisi, I'll let you go first.
I will even start with my mom. So you'll be surprised. My mom is a graduate. Yeah, my mom is a graduate. My mom is so I'm talking about someone who is really educated.
Yeah.
And she sends me this video on social media. And it has some woman saying that some people in London took this vaccine, and out of 500 of them, 400 died. And my mom is saying, are you sure you really want to take this vaccine? She's not even talking about herself. And my mom represents everybody out there. This was one of their worries, and genuine worries and fears. I had so many people know you're a pharmacist, and people, they know I'm a pharmacist. So I get bombarded with all sorts. And I don't read them and ignore them, because everybody has genuine fears. They want to know, how come you're getting this vaccine? Or how come people are actually giving out this vaccine? How come it was rolled out so quickly? How? Yeah, it takes 10 years. We hear it takes years to get a vaccine. How come this one was done in months? You find yourself educating people. I had to start with my mom, my family, and customers coming in through the doors. telling them that yes, because yes, we agree that it used to take long, but because this is an emergency, we saw how it was affecting lives, the economy, people, mental health, everything. People had to join forces. The WHO, everybody got involved, and they were working really, really hard. So some phases had to be merged for us to have it as quickly as possible. And we still went through, even though we had it quick, it still went through all the phases. No stage was left out for it to for us to still get a very safe vaccine. So we get questions all the time, people coming in with videos, concussions, can I take this instead of this? If we do this, we hear that this and that, but we patiently reassure them with evidence.
Yeah.
That's what we're doing. Yeah.
Thanks for that. Bola?
Damaging effect of all these messages was the anxiety, or is the anxiety that it's causing within our communities. So as we've heard, we're there and we've had to educate ourselves based on the facts. As scientists, as pharmacists, we know the facts, but also we've had to educate ourselves with regards to all the myths that are out there, so that we can actually explain and debunk these myths in a very factual way. And I'll just sort of summarize with two examples of patients that I've been in contact with. So there's a lady who came into the pharmacy, and after a couple of people had explained to her, as pharmacists went to her, she asked several questions, and for each question that I provided an answer, and a factual answer, she would ask another question,
Yes.
So why is it that people say this? Why is it that people say that? And then in the end, I asked her very simple questions. Do you know anyone who's had the coronavirus? And she said yes, her neighbor, a neighbor's friend, or a friend. I said, okay, so what would you rather have, coronavirus or the vaccine? And she looked at me and she said, yeah, that's another way of looking at it. So it's about understanding the person and their fears, and being able to present the information in that they would understand and they can comprehend. Now, I don't know if she went away and had the vaccine, but what I know is that she had a change of thought, and I dropped, it was like a penny dropped, and she was away and reflect on what she heard.
Yes. There was a pause for reflection, wasn't there?
Yes.
One of the challenges that are around now is long COVID. So I just wondered, what has been your experience around that, and what you might be saying to customers, clients when they come in around that?
So in terms of long COVID, it's still relatively new. COVID itself is new in terms of the disease and the condition, and we're still learning about impacts of and the effects of COVID. So long COVID is basically, to describe it, in general terms, is people still experiencing the effects of COVID long after they don't have the virus. They've had a negative test and they've still got symptoms. They haven't recovered. Now, these symptoms are diverse in nature. Some people, it's breathlessness. Some people, it's actually pain, aches. They really can't go on as normal as they usually would. And so there are anybody who has these symptoms after long COVID need to see their doctors, because there are ways of managing it. There are also centers that are being set up to manage long COVID as well. And there's more information that's coming out around the management and drugs that can be used to manage long COVID. But it's very important that people actually come forward and go to their GPs about their symptoms, because these need to be recorded and they need to be treated and supported.
Yeah, because there's quite a long list of symptoms, including, as you mentioned, extreme tiredness, shortness of breath, chest pain or tightness, problems with memory and concentration, difficulty sleeping, heart palpitations, dizziness, pins and needles, joint pain, depression, anxiety. So not that somebody's going to get them all at one go, but again, anybody with feeling those sort of in that way can again go to you in terms of the local pharmacy for at least sort of first point, friendly face, and then you'll refer them accordingly. Okay, that's great. So you touched on testing. So I know as community pharmacists, there's the various COVID testing. Could you tell us a bit more about that in terms of your role within that area? Is it the lateral flow?
Yeah. So just recently, there's we just started a new program called Pharmacy Collect.
Right. Okay.
Yeah. So you get patients who are asymptomatic, so you don't have symptoms. The emphasis on people who are not showing symptoms, but people who are starting work, going to school. It could be teachers, it could be workers, it could be meeting up with people. I've had some elderly people who have come in and said to me, I'm meeting up with 2 friends in the garden, but I'd like to be sure that I'm safe and they're safe too. So we have a program which has just started, and where you can go into any pharmacy and pick up a pack of 7. It's got 7 tests in it. We're there to advise you on how to use it, how to get your results back. You do it at home, so it's a home kit. The patient uses. Yes, it's a home kit. You go into your pharmacy. We ask you a few questions, which are very confidential, and we don't even take your names, so it's anonymized.
Okay.
So we don't take your names, but you just go into the pharmacy. It's very easy to use. Pick up the lateral, go home. You don't even have to bring it back. There's a step-to-step instruction on how to use it. And if there are any fears or any concerns you have, you can come back to us. But that's the latest thing that's available now. And people are coming in and using it. All you need to do is go to your nearest pharmacy. Some people have to use a website, but most pharmacies now are using it, or have them available.
So how long does it take to get the result?
When I've used it, 15 minutes.
15 minutes, okay.
Yeah, I've used it because we have to use it as well. Yeah,
excellent. Right, just before we close the show, I'd just like the 2 of you just to give the people of Croydon and London and Nigeria and the world and the Caribbean, because we're online, of course.
Yeah.
Just, what's your last real message as it relates to the virus and the vaccine and keeping each other safe?
Say that, please, if you have been called up for your vaccine, please go for your vaccine. If you have any queries, go to your nearest community pharmacy and seek advice. We understand that people are apprehensive, but your trusted healthcare professional, the community pharmacy, is there to provide information and advice. In addition to that, I would say still continue to maintain all the necessary precautions. So, hands, face, space, wash hands, keep social distancing, and really look after yourself. look after, your neighbor, and keep an eye on people you know. So give them a call. There are a lot of people who are still a bit apprehensive about coming out of lockdown. So keep an eye on your neighbor and call a friend.
Thank you very much for that. And Ifeisi?
So I would say, COVID is real. People need to know and believe that COVID is real. We all know someone who's been affected and in some cases died. So COVID is real. We need to listen to whatever the government is telling us. There is the Department of Health. We need to go to people who have trusted information. And that means you can come to pharmacists. You don't need an appointment. Walk into a pharmacy for any information you need. Do not believe everything you read on social media. Walk into your pharmacy, speak to your trusted pharmacist, and get real and accurate information. Thank you.
Thank you very much. And thank you both, Bola and Ifeisi, trusted health professionals, community pharmacists based in Croydon, Southwest London. You've been speaking to the world on African in London TV. Thank you very much, and take very good care of yourself. And
Thank
good
you.
night. All.
Thank you.
Good night.
Bye.
Bye.